Good evening, everybody. I welcome you all to this telephone town hall. I want to especially thank my co-hosts, who I will introduce to you all in a moment, but I really most especially thank constituents who have called in. I'm Madeline Dean, Congresswoman for the 4th Congressional District, and we're hosting this telephone town hall, the second telephone town hall that we have had on the issue of coronavirus. We had one just last week on March the 11th. We held our first telephone town hall for our congressional district of Montgomery and Berks counties, and that one focused on health and on coronavirus itself, the symptoms, and what we were learning here in Montgomery County and Berks counties. This one, as you saw, is focused on the economy, but it would not be right for me to go forward as we talk about the economy without first talking about what we know is fundamental, which is we must get a handle, mitigate, and reduce the spread of coronavirus. And the three principles that I have heard are that we must do as much testing as possible to identify the disease. We must also continue with the social distancing, and I know the constituents of the 4th Congressional District are taking that very, very seriously. It is our responsibility. And then, of course, we are in the search for treatments, cures, and vaccines. So the health piece is going to be critically important to the health of our economy. So I didn't want to begin without saying that, and without saying a huge shout out to the healthcare system, first responders, and all the healthcare workers who are every single day serving all of us at great risk to themselves and to their families. And so I am in awe of their extraordinary skill and service to all of us, and I'm very optimistic that we will get on the right side of this and come out, I hope, I pray, stronger for it. On our call tonight, and just let me give you some instructions. For those of you on the call, if you would like to ask a question, press *3 on your phone. You'd be connected then with a staff person, and I know we will have probably more questions than time for all those questions. So if for some reason we don't get to you, please be sure to email me at dean.house.gov. Again, it's *3 on your phone for questions. Here's how we'll run the show tonight. I'm going to introduce our four speakers, the experts that I've asked to join me to help me learn what we need to know as we go forward with policies in Washington that I hope make important differences for families here. Each of them will give a little bit of background on themselves and an opening statement to give us their perspective on where we are and where we need to go. And then we'll turn it to your questions, and our host will help us get through that. The speakers that we have, Dr. Mohamed El-Erian. He is an economist and a Wharton professor with extraordinary expertise, education, and great experience, and I'm sure will be able to offer us what he learned from the 2008, 2009, and beyond economic recession, great economic recession. I'm very pleased that he is joining us. We will also hear from our Secretary of Labor here in Pennsylvania, Jerry Oleksiak. He's Secretary of Labor and Industry. We'll hear from Carol Kilko. She is Deputy Secretary for Business Finance of the Department of Community and Economic Development. And finally, we'll hear from Michael Kane, Deputy District Director, U.S. Small Business Administration for the Eastern District Office here of Pennsylvania. I do want to say at this time, from the federal point of view, we have passed two pieces of legislation that have been signed by the President that I'm very pleased. We're very bipartisan. There's no partisanship in tackling a crisis of this kind. So we passed an $8.3 billion package that has important dollars for research, for testing, for small business administration, for healthcare supplies. Just last week, the President signed the second package that we passed, another package that was really focused on families, making sure that there's adequate access to testing, making sure that there is paid sick leave and paid family leave, and also making sure that there is food security through the SNAP program, through the child senior meals, student meals, and food banks. Now we are considering an important third package that I hope will be very robust, and our experts can help me craft and put my input on that, and I'll be eager to hear from them. And in the end, what I hope is that we'll see this in the spirit that we are all in this together. And there's something, I think, very reassuring about this. Even as we have to do our social distancing, we owe each other a responsibility. We in government owe all of you a responsibility, but we as neighbors owe one another a responsibility. So it is in that spirit of togetherness that I want to open up this conversation, and I'm going to throw it, if I may, to Dr. Mohamed El-Erian. He is an economist and Wharton professor, and Doctor, it's your turn.
Thank you, Congresswoman Dean. I really appreciate you having me on this call, and thank you all for being on it. And I join you in a shout out to all those in the healthcare system that are really doing incredible work. As Nat said, I am Mohamed El-Erian. All I will say about myself is I've worked by accident, not design, at the intersection of economics, public policy, and markets and business, and I'm old. Let me start with a fact. We are facing a health crisis. If this wasn't enough to make us feel unsettled, to make us feel scared, we are also facing major economic and financial shocks. And my aim in 3 minutes is to share 5 bullet points to help explain what we're facing, why, and so what. First, the context. A necessary phase in this health policy response is social distancing, separation, and isolation. That should and is dominating. It is inconsistent with the way our economy and our markets are wired. Our economy and markets and social interaction aren't wired for distancing, separation, and isolation. They are interconnected. They are wired for ever closer integration. So it is not surprising that this inconsistency has led to what we are seeing every day in the economy and what we're seeing every day in the marketplace. Second, what are we exactly seeing? This unusual economic and market volatility and disruption results from what economists call a sudden stop, when everything just stops. It is really unfamiliar to most people. If you've lived in a failed state where you're afraid of going out because your streets are being bombed, if you live in a community hit very hard by a natural disaster, you know what that's like. But we have never seen this happen at a level of a country, and we have never seen it in a normal country, and we have never seen it happen at the level of a global economy. But it is happening. And to make it very simple, the economics, it doesn't matter if you want to buy something. It doesn't matter whether the store has it. It's not going to happen. You can have a desire to buy something. You can have the money to do so, but you can't get to the store. And the store has what it wants to sell you and is able to sell you, but it can't because there's no interaction. That is massive demand and supply destruction, massive destruction of consumption, and massive destruction of production. And that is what we are feeling and going through now. Third, to turn the economy around, you need what the Congresswoman stressed, which is for all of us to have assurances that the virus can be identified and contained, that illnesses can be treated well, and that immunity can be increased. A vaccine is, of course, the fast-forward solution to most of that. But in the absence of that, it is about testing, it is about social distancing, and unfortunately, with the social distancing comes the economic and market disruption. My fourth point, there is a lot that policy can and is doing in the economic and financial realm, but there's also something it cannot do. And we have to make that distinction because the time will come when it will be able to do it, but it's not now. What can policy do? Well, we are seeing it coming together. Policy can protect the most vulnerable segments of society during these massive disruptions. Policy can support the strategic sectors, starting with healthcare, but it's not just healthcare. Also, national security is really important. policy can bolster balance sheet to make sure that a liquidity problem doesn't become a solvency. What do I mean by that? For people who live from paycheck to paycheck and suddenly they've lost their jobs, nothing to blame them for that. The worst thing that can happen to them is they start missing payments, and then they become bankrupt. They have to declare bankruptcy and disrupt their lives for the next 7 years. Same with a company. A company will have no revenue for a while because it can't open its stores, but it doesn't mean it should be pushed into insolvency. Same for a state, a municipality. So we have to make sure that we can protect balance sheets to make sure that liquidity problems don't become solvency problems. We can do that, and steps clearly are being taken in that direction. What we cannot do is reactivate economic activity, because it's not a matter of lower interest rates that allow us to refinance our mortgages and put more dollars in our pocket. It's not that we can get a cheaper loan. It's not even that we get a tax refund. It's not about us not having the means to spend. It is about us not being able to spend. So economic policy cannot create stimulus that re-engineers and re-energize the economic activity. For that, we need the medical solutions first, and then that policy will be incredibly potent, which leads me to my final point, and I'm going to end with a personal note. Like everyone else, our family has been yanked out of its comfort zone and finds itself in an incredibly unsettling, uncertain time. And yes, we were afraid, and we are afraid. We have found it incredibly important to remind ourselves every single day of the difference between a journey and a destination. And those of us who have taken our kids to even an amusement park where clearly the destination is going to be a lot of fun, but the journey lasts for 4 hours, and all you can hear from the back seat is, "Are we there yet? Are we there yet?" You know that even a good destination can be associated with a bad journey. That's what we have right now. This is not about the destination of our economy and our financial system. I share Congresswoman Dean's optimism about that. This is about a very uncertain and bumpy journey that will end. And as the Congresswoman said, we are all in this together, and we will navigate through it together. Thank you.
Thank you very much, Mohamed. Very much appreciate your perspective and your experience and bringing it to the journey. That is, we are all on this journey together, and so let's see how we can do it as best we possibly can. Just a reminder before I introduce the Secretary, if you want to ask a question, please press *3. And if for some reason we do not get to your question, know that you can always email into me, and we will be continuing to answer your inquiries or take your ideas. My email is dean at my website, dean.house.gov. So please go on our website and contact us. Next, we have Pennsylvania Secretary of Labor and Industry, Jerry Oleksiak.
Thank you, Madeline, and thank you to those on the call. And I want to do a quick shout out not only to the medical and first responders you mentioned, but we have a terrific staff at Labor and Industry who are working incredible hours to continue to provide the services that our citizens need. Just a brief bio. I am not some faceless Harrisburg bureaucrat. I am a member of the neighborhood. I lived in Abington Township for a large part of my life and just recently moved to Upper Dublin Township, so I am a constituent of Madeline, and I care very much about this community and the Commonwealth. As Secretary of Labor and Industry, just briefly what we do, we have 5 major areas within our agency: unemployment compensation, workers' compensation, workforce development, safety and labor management, and OVR, our Office of Vocational Rehabilitation, which works with our citizens with disabilities and helps them find employment. Clearly, the one that we are focused on primarily right now is unemployment compensation. And we are approaching this from trying to balance two very competitive pieces here. We want to obviously provide the service that our fellow citizens who are in dire need require, and we are a large employer. We have close to 4,000 employees, and we want to protect the health and safety of those employees. We have been preparing for this for weeks. We have had our what's called our COOP plan, which is our continuity of operations plan for the agency. We have had regular meetings with the governor and the cabinet. We have had, I have had in my agency daily meetings with our leadership team for probably the past 2 weeks or longer, and to plan for this. And we've planned it to respond to what we anticipate might happen, not just what has happened. It's a very fluid situation, as you know. It's an evolving crisis situation. So we make the plans, we carry them out, and then we adjust as needed. I can tell you right now we have had a record number of unemployment compensation claims, initial claims. We can't give out the exact number. Those numbers are embargoed until next Thursday. So whatever we do this week in our unemployment office, we can't release those numbers until next Thursday. That's federal law. And all I will tell you is that it's record numbers. So we are seeing daily how this crisis is impacting people directly where they live. We've made some changes in our system. We have made some regulatory changes where we've done away with the waiting week. Normally when someone applies for unemployment, there's a week where they don't earn anything. That has been done away with. We've done away with the work search requirement. Normally, when someone is on unemployment, they have to be looking for other work. We've suspended that during this time, and also for employers, there's relief from charges. So if an employer has people who go on unemployment, often that will raise their insurance rates that they pay. That will not happen as a result of this. So we have, as the Commonwealth, under the governor's orders, shut down in large ways. We have essential personnel. We have emergency personnel who are working in state buildings throughout Pennsylvania. We have a large number of people who are working from home, as I am. When Montgomery County was the first county that was, ordered by the governor to close down the way it did, I began working from home. I asked to stay working in Harrisburg. I was told to go home, and that, correctly so, I think. So, we have people working from home. We're expanding the number of people who are working from home. I know it's been difficult at times to get through in the unemployment compensation system, but when I tell you that we are dealing with record numbers, I mean numbers that we're doing in a week that normally we don't do in a month. So we're doing all we can to adapt our system to the needs that we face right now. I want to give out a couple links, and if you have a paper and pencil handy, please get these down, and I will share these with Madeline so that you have them. I'm going to give you 3 different links to check. One, and if you've been following Dr. Levine, and particularly Dr. Rachel Levine, our Secretary of Health, she's been doing daily briefings, often with the governor, occasionally with other cabinet officers. www.healthpa.gov. That's the Pennsylvania Department of Health website. That's health.pa.gov. And there are several links to what's going on with the coronavirus, updates on things that are the daily changes in the numbers and in what's available. So again, health.pa.gov. The other one I want to mention is uc.pa.gov. uc.pa.gov. That's our unemployment compensation website, where you can begin, if you are unemployed, the process to begin receiving unemployment compensation. And one other one I want to give you is uc.pa.gov/COVID-19. where you will get see frequently asked questions related to unemployment. Let me give that to you one more time. It's uc.pa.gov/COVID-19. There are a lot of questions that we're getting. We have updated our frequently asked questions, and we're updating them regularly to respond to the number of calls and questions that we are getting. I can tell you that, and then the last point I want to make is that I've been Secretary of Labor and Industry for 2.5 years now, and from the very beginning, I have constantly reminded our staff that it's important that we, as the people who make that system run, make sure that we follow the policies and follow our budget and cross the T's and dot the I's. But what's most important to me, and I believe to our staff, is that we recognize that there are real people at the end of the process. You are my neighbors, you are friends in some cases, perhaps. We have colleagues, relatives that are being directly impacted by this. And one of the best things about labor and industry is that the things we do respond to those immediate needs of people. It may take a little longer than we like. Wait times may be longer. We're still processing things, anticipated processing claims within 2 to 4 weeks, so that someone will begin to receive their benefits. But we are very keenly aware of the needs of our fellow citizens. So with that, I'll stop now and answer questions later. Thank you.
Thanks very much, Jerry, Secretary of Labor and Industry. And as you said, I just want to remind people, it was only 2 weeks ago that we had the first reported cases here in Montgomery County. We were first in the state. Sadly, we appear to be a bit of an epicenter here. As of today, earlier today, our count in Montgomery County is 68 confirmed cases and 5 confirmed cases in Berks County, and of course, many more people being tested as we go. Sadly, in Pennsylvania, we have had 1 death. And so these numbers are increasing. I hope through the social distancing, we're going to see the flattening of that curve. But now let me throw it, please, to Carol Kilko, Deputy Secretary for Business, Finance, Department of Community and Economic Development.
Thank you very much, Congresswoman. I really appreciate the opportunity to be here with you and all your constituents. I am the Deputy Secretary for Business, Finance, and Workforce Development at the Department of Community and Economic Development. I'm going to say DCED from now on because that's so much easier than the entire name. This has been unprecedented for our agency, for the entire Commonwealth. No one has ever seen anything like this, at least in our lifetime. The issues that are affecting our businesses across the Commonwealth are quite varied. And with this social distancing, the closing of physical locations of so many of our businesses, which those of us involved know full well that this is what needs to be done first and foremost. It has not been an easy decision for the governor. It has not been taken lightly by anyone that is working with him. Our Secretary Oleksiak, others have been working very closely with the governor, talking through all of the issues. But our Department of Health Secretary, Dr. Levine, has definitely made the case that this social distancing has to happen. And as our first guest this evening said, this is not the way our economy works. And our companies and our businesses are truly having difficulty and not understanding, what do they do next? And we understand that. And what we've been trying to do at the DCED is try to address some of the issues that we've been told are happening and need to be addressed immediately. Let me talk to you a little bit about how we've approached that. First of all, the first thing that our agency did we worked with our Pennsylvania Emergency Management Agency, PEMA, and also the Small Business Administration on the federal level to get pull the requirements together that our state needed for the governor to send a letter to SBA to look for to have this entire state designated so that our small businesses would be eligible for the economic injury disaster loans. We were able to do that in very short order, did that by using a lot of the partners that we have across the Commonwealth, because we know we can't do this alone. We have a lot of people that work on the local level and regional level, and there are boots on the ground. So they're the ones that came to us with the information that we needed. And there's another speaker from SBA, and I'm going to have him, he's going to go into some of the detail that you will need for those loans if you are a small business. We are, with that being said, we also as an agency knew that at the state level, we would want to be able to pull together the funding that we had to be able to help our small businesses in Pennsylvania. They're our backbone. We understand that. They're the ones that are the most vulnerable in our economies, and we need to be able to assist them. Many times, a lot of our programs aren't as flexible as they should be for some of our even smaller businesses in our communities. And so we knew that, and we heard that from a lot of our partners across the Commonwealth. We held a couple, 2, 3 different calls similar to what is being held tonight with various different stakeholders across the Commonwealth, and we said to them, tell us, what are you hearing from the business community? Help us devise a program or re-engineer what we're doing so that we can be more flexible and relevant to our business community. And that was extremely helpful. And what we ended up doing is working with a program that we already had in place called our Small Business First program. And it is a loan program for small businesses. And part of what we loan out is working capital. So we knew that this was at least a start. So typically, our program for working capital is 3% interest. The first thing that we did is we are going to be asking our board to approve no interest loans through this program. We haven't gone to the board yet, but we have had significant discussions, and we fully expect that there's going to be these loans available for working capital for our small businesses up to $100,000. We've also done a number of things with the particular program to it will be much more flexible and easier for our businesses to apply. Now, I need to say one thing. There is a group of certified economic development organizations across the Commonwealth, and particularly in your region, Congresswoman, that are going to help these businesses apply for these loans. I would be more than happy to send you a list of that group so that you can disseminate that or make it available on your website. And all of this will be available on DCED's website, and I will give you that at the end of my remarks.
That's great. Thank you, Carol.
You're more than welcome. That particular loan program, I'm really excited and happy to be able to report that the funding that we had in that program was only $20 million left, and we had another program with another group, which was a bipartisan group called it's the CFA Financing Authority. And the board members are in the legislature, and they all agreed to transfer another $60 million into this program to allow us to get this money out to our small businesses. And that was just a very good thing, as I'm sure, Congresswoman, that you experienced with your pieces of legislation, that has been bipartisan, because everyone understands how important this is and where we're going. That is the main thing that we are doing at DCED. We have other initiatives. We are very involved with the with the governor's waiver and exemption form for the non-life sustaining businesses on the closures. We have resources for all kinds of resources and lists of resources available for businesses that are affected by the COVID-19. All of that can be found on the DCED website, and that is dced.pa.gov. Very simple, and as soon as you get on that, it comes right up. It's there. You can get to that information. The loan program that I was telling you about will not be available until Wednesday of next week. We have to get everything in line, which we're almost there, but we have our board meeting on Monday. But Congresswoman, I would be more than happy to send you the information so you're ready to give that to your constituents. So with that, I will end it and hope to be able to answer questions that we will have. Thank you.
I thank you for this really great information. And just for everybody on the call, I ask for your patience. We have a tremendous number of questions and good information. We're going to be able to take the call a little past 1 hour, so please stay with us. Again, press *3 if you have a question. And now I'd like Michael Kane, Deputy Director of the United States Small Business Administration for the Eastern District of Pennsylvania, to give us his opening remark.
Thank you, Congresswoman, and for all the small businesses here that are on the line, I just want to let you know that the SBA is here to help you, and I think that's probably one of the most important things I want to make sure to get across to all of you. My name is Michael Kane. I serve as the Deputy District Director for SBA in Eastern Pennsylvania. I've had the privilege of being with this agency coming on 13 years, working with small businesses all across the Commonwealth. And as Ms. Kilko talked about, the small businesses are the backbone of the economy, the economic engine, if you will, of the Commonwealth and frankly of the nation. And we are in unprecedented times right now, and folks are confused and they're fearful and not really knowing, what to do. So what I'd like to do is utilize my time this evening to talk to you about what SBA is doing to provide needed assistance to small businesses here in the Commonwealth to help them survive and really get through this crisis. And, I can tell you that we have been working hand in hand with our partners over at the state level. And, we've have great relationships going back many years, which really enabled us to move quickly on this. And, we started our conversations kind of the beginning of this week, and in a matter of days, we had a disaster declaration covering the entire Commonwealth, so all 67 counties and all businesses that are impacted, to be able to be taking advantage of what we call the Economic Injury Disaster Program. And, typically this program is utilized in conjunction with a natural disaster, but this is the first time that it has been implemented at the level that we're seeing, due to the severity of this crisis right now related to COVID-19. So what I want to I just want to briefly provide some details about this program. First and foremost, where you would apply for it, and the online portal is open. So it opened as of yesterday afternoon when Pennsylvania received its disaster declaration from SBA. So any business that's impacted through COVID-19 can apply at disasterloan.sba.gov, right? So disasterloan.sba.gov. And these loans are designed to provide working capital to small businesses as well as private nonprofits to help them through these extraordinary times that we're in. The terms and conditions of these loans are very generous. They're designed to have terms up to a maximum of 30 years. With an interest rate at 3.75% for for-profit small businesses and 2.75% for nonprofits. And a small business can borrow up to $2 million with this program. So it is really designed to provide a substantial amount of working capital for small businesses that are being impacted, to help them pay their bills, to help them make payroll, okay, so that they don't have to necessarily lay off their workers, and frankly help all the small businesses to get past this current crisis until the economy begins to improve that customers start coming back in the door and spending money. We recognize how challenging this time is. I want to let you know that just like many of you, my office is working in a telework status, so all of my staff are working remotely, but we are still open for business and taking questions from any small business that is looking for help. My office number is 610-382-3062, and I will have someone that can answer the phone and speak to you briefly and link you up with one of our lender relations and economic development specialists. Again, I want to let you know you are not alone. We are here to help you, and we will help you. And that's all I have right now, Congresswoman. Thank you so much for including me on this evening's call.
Michael, thank you very much. Thanks, everybody, and thanks, everybody, for the terrific information that you offered. We're now going to turn it to the question portion, and I would ask anybody who wants to ask a question, *3. We do have a lot of questions already in the chute, so I thank you for that. And if you have, when we recognize you, if you would, and if you can, direct your question to one of us. I'm going to start with a friend and colleague, Representative Matt Bradford. Matt Bradford serves in the Pennsylvania House for Montgomery County. He is also the chair of the Appropriations Committee, and he is a fine public servant and my friend. Matt.
Thank you, Congresswoman Dean. Thank you for your clear-headed and compassionate response. I realize these are, as to use the term everyone's using, unprecedented time, but you've been a great leader for Montgomery County, and I want to thank you. But one of the concerns, obviously, at the state level is just because of the magnitude of the challenges ahead of us, we're going to need not just a timely response, but a robust and comprehensive federal response. Our state governments, while doing amazing work, and I was glad to hear Secretary Oleksiak and DCD talk about what they're doing, at some point, just resources as we go from response to recovery and really rebuilding this economy to get not just employees, but employers the help they need. We're going to need federal assistance. Obviously, you guys have done a great job getting that ball rolling. What's that going to look like going forward?
Well, I thank you for the question. Thanks for all you're doing. As you can imagine, we have been on so many conference calls, learning from experts, but also arguing for what we think needs to be a part of the third bill that the Senate is considering now. They're on a phone call literally tonight in a bipartisan way, trying to hammer out the details that they want to come forward with. But I will tell you, on every single call, and I've been on a couple dozen, support for municipalities is one of the foremost things that we talk about. We recognize at the federal level that we are going to have to provide direct funding to local governments, whether it's reimbursing fire, police, emergency. That has to be a part of the package. We also, I'm a part of a caucus, and one of the things that we are fighting for is to use emergency authorities. The Treasury and the Federal Reserve should buy municipal bonds, make sure that insurers see their costs of finance, that they don't see these things spike. So we know that part of whatever we do has to protect human capital by direct support to people. It has to protect our businesses by direct support to businesses, small, medium, and large. But it has to, and there has not been a single conversation that neglects municipalities, the state governments, of course, but local municipalities and direct support for local municipalities. So I believe it will be an urgent part of the next package, and I don't believe bill number 3 is going to be the end. We're in this for a longer haul. All right, thanks, Matt. The next question is from Sandra.
Hello?
Hey, you can ask it now.
Hello? I have a question. I'm very concerned, with this virus and everything, because I'm 81 years old, trying to stay in the house and healthy. I wanted to know, I depend on this real estate rebate that I get to pay the rest of my taxes. Are they still going to be having that?
I think you're talking about the property tax rent rebate.
Yes.
And also, yes, I believe the state will continue processing those, and that is critically important. I was a state representative along with Matt Bradford before I went to Congress, and we know how critically important those are. I believe the state is going to stay on schedule with those. The other thing that's awfully important is for people who are filing their taxes, their income taxes, and are dependent upon reimbursement for their tax returns. People should continue, if they can, file on time so that you can get timely return of your tax refunds. Both of those sets of resources, whether it's the property tax rent rebate or your income tax return, those are both sources that we want people to go forward and process. If I'm saying anything wrong on the state side, Jerry or the others, let me know.
Yeah, Madeline, I have heard of no program like that's been suspended. We are doing all we can to continue to meet the obligations and the commitments we've made to our citizens. Carol, I don't know if you've heard anything otherwise.
Yeah, I have to say the same. I've heard nothing like that. In fact, everything that I've heard in discussions that I've been involved in is only to strengthen those kinds of programs and to make sure that it happens. Absolutely.
Great. And I want to make sure, Mohamed, did you have anything you wanted to add? I should have let you speak on the first question about aid to municipalities. And what a package should look like. What should we be thinking about?
Thank you, Congresswoman. And I think, like you said, we should expect something there. A package would be aimed at stabilizing the market so that we don't have disruptions that starve municipalities and local government and states from the ability to raise money in the future. It would be administered by the Federal Reserve. It would be a special window, if you like. And really, the bottom line is to minimize market breakage, not because markets are special, but because they are the vehicle to restoring normalcy, and we will restore normalcy. My understanding is something is being worked on as we speak. Thank you.
Madeline, if I could add something quickly?
Yes, go right ahead.
Sure. One of the things that I know our unemployment compensation system will need is, surprisingly enough, dollars. Most of our direct funds that provide unemployment compensation come from taxes and insurance that are paid by employers and employees. We do get significant federal dollars that go toward our administrative costs. So we're going to need, at some point, we do not have finite resources, as you know. We're going to need some support for the unemployment compensation systems around the country, not just administratively, but in many cases for their trust funds as well. In the past, when there's been recessions, the federal government has lent money to the states, and sometimes they have been interest-free loans. Other times they haven't been. But any support that could be provided to the systems across the country that provide unemployment compensation would be a significant help.
Thank you very much. Our next call is from Richard.
Full-service off-premises catering throughout the region, and as a result, my business has effectively gone from a successful business over 50 years to potentially zero revenue and zero income for the next 4 months. All of our events that we've had contracted for through the end of May have canceled or postponed. I understand. I was online for about 4 hours today trying to access the SBA. I understand it's overwhelmed. But my particular concern is that the information being provided at the state level is not accurate. Originally, companies like mine were directed to the Pennsylvania Small Business First Fund, which apparently is non-existent. When you go to the PIDA link and it says to apply, it's simply a name and a phone number. So I'm wondering if the state applications will be available online, or are we going to have to wait for the individuals in these local offices? I think the name that was redirected to was David Niles at the Monco Development Office in Plymouth Meeting. Or do we have to just wait for them to call us back?
Yes, this is Carol with DCED. I'm on our website right now, and I'm not. You said that the PIDC was non-existent. What I can tell you
No, the
is
small business first one redirects to the PIDA, and when you click on PIDA and it says apply, it's all it is a listing, a PDF listing of offices. It's not an application.
That's correct. First of all, the program that I was talking about that is going to be specific to our small businesses that are affected by COVID-19 will not be available until Wednesday of next week. There will not be an application on our website. There will be information in us, and what is confusing you, I know, is that list, that person that Mr. Niles, that you were to call him. We are working through those groups. They're called our Certified Economic Development Organizations to help you with the application, because to make sure that you're able to, get the information that you need for the application, and they will submit it on your behalf. I hope you have more
than one individual who's going to be handling these applications, because you have thousands of companies that are affected by this.
Yes, we understand that. We absolutely do. We have 60 across the Commonwealth, and I'm not sure how many exactly are in your area, but it's more than one person. Each of those groups has more than one person. There's one
office in Montgomery County.
Okay. If you have a problem, have you called Mr. Niles?
Left messages.
Okay. All right. Congresswoman, I'd be more than happy to help this gentleman if someone could get me his information, if that's possible, or I can.
We will take your information. But to your point, Richard, you are one of sadly many. There's going to be a tremendous number of small business owners. I think of the restaurants and the caterers and all of the extraordinary, terrific stories of people growing businesses that are in incredibly serious jeopardy from the federal level. And so, Richard, make sure we have your contact information. But I want to say to the thousands of others within this district who have this same kind of concern, we're just getting started. The first bill that we passed had $7 billion in low-interest loans to affected small businesses. That was just a start. We know that in this next bill, in the conversations I'm hearing, that number has to be much, much more robust, 25 billion. It has to be so much more robust. There's also conversations around grants, not loans, but grants to small businesses. The other thing that I believe and I know is that with small business loans, if we make them accessible and quickly get capital to you so you can sustain that business and keep employees and hope to re-up and reopen and repurpose when you can, we know that many of these SBA loans are going to be paid back. So it's not as though we're out the money entirely. But know that this is just getting started. I believe the first bill was only a start, not nearly enough, and there's more to do. Anybody else on that one? And Richard, if you would offer your contact information to us, that would be great. Okay. The next call, and again, it was *3, although I think I probably have tons and tons of calls here already lined up. Charles.
Hi, I'm a retiree, and I'm 60-plus years old, and I'm just looking at the new legislation you're all working on. I know you're still in the weeds on that, and I know you probably can't give details because it's still in flux, but what I was thinking about is as a retiree who hasn't had a W-2 for several years, I was wondering if I will be able to be part of the legislation, considering the money that you guys are going to provide to Americans as an individual, not through a loan or anything like that, but the checks that they were talking about. And then also I'd like to make a comment. As a Vanguard retiree, I'm glad you have Mohamed on here because the gentleman knows what he's talking about. And thank you for your leadership, Matt.
Oh, thank you very much, Charles. I'd be happy to let anybody else speak on this, particularly Mohamed, if you have thoughts about how we do this and make sure we protect seniors as well in all the conversations. And you're talking about, for example, direct cash payments. It is amazing how quickly this has moved under our feet. And I've been arguing for direct cash payments to Americans, seniors included, of course, and children, because we know that, as Mohamed described so aptly, this sudden stop, this jolt, and just a freezing of our economy in terms of supply and demand, we have to make sure that we get direct cash payments to everyone. And so there are multiple different scenarios. I have introduced a piece of legislation that mirrors one that was also introduced by Senators Bennett, Booker, and Brown, Sherrod Brown, in the Senate. It is direct cash payments to all adults, $2,000 for the first payment for adults, $2,000 for children, and then a quarterly reduction based on employment and unemployment figures for the next 2 quarters moving forward. We don't even know the depth of the need that we need to drive dollars and resources to America's families, but know that seniors are certainly a part of it. Mohamed, could you tell me your perspective on that?
Yes, you are absolutely right. The approach to this is through direct payments, get them there quickly. The approach that you have just explained, it is the best approach. I know there may be better ways of doing it, but speed is of essence here. We have heard on this call, and I'll come back to that, of the importance of quickly getting oxygen into the system before it freezes completely. And at some point, there will be need to refine it. There will be need to adjust it as we learn from experience, because this thing isn't going away anytime soon. But let's not make the best the enemy of the good when we have to react immediately. And let me just thank Matt for his kind words and thank everybody. I think the feedback you provide as to what you are experiencing is 1,000 times more effective than economists like me trying to explain what is going on in the economy. We heard from the very successful business owner of what it's like to suddenly have liquidity problems and risk insolvency. Matt, you told us what it's like for retirees, and I think these sorts of stories are what will drive the response. Thank you.
Thank you very much. The next call and question is from Che Lee.
Yes, hi. Thank you so much for taking my call and for your leadership, Congresswoman, and for each of the experts on the line. I really appreciate the support and just feeling supported in the isolation, so thank you for that. I have 2 questions. My first question is what type of support, I know the bills that have gone forward, but what type of support is there for those that are self-employed? So my husband is a therapist, and obviously, there's no face-to-face clients because people aren't coming out, and I'm a fundraising consultant, so obviously no one's doing fundraising right now. So that's sort of part one. That's part one of my question. And my second part is we also, because of that, get insurance through the marketplace, and I haven't heard anyone talking at all about that. My husband is also immunosuppressed. He's a kidney transplant patient. He's had his transplant in 2011, but he's obviously immunosuppressed. So if we lose our insurance because we have no income, that's an issue. Is anyone addressing those that get their insurance through the marketplace to ensure that they don't lose their insurance because of this? We're sort of worst case scenario here.
Thank you, Che Lee, for your questions. I want to ask Michael or Carol help with the independent workers, the freelancers, and then we can also talk about insurance.
Sure. Hey, this is Michael Kane from the SBA. So as a part of the eligible types of businesses for the Economic Injury Disaster Loan Program, sole proprietors, folks that are self-employed, such as you and your husband, that you would definitely qualify for that particular program. So, if you go into the application portal, you would identify as a sole proprietor. There's some documentation that you would need to upload as a part of your application, such as, your previous taxes and things like that. But it's pretty easy for you to fill that information in. The other thing that part of the application process they'll be asking you for is, the level of financial impact that you've experienced and what you're projecting that impact to be, as a part of determining, how much of a loan, for example, that you would qualify for. So if you need help with that, I can tell you that, we have some resource partner organizations that we work with that are offering free assistance to help folks with that, to help them with the application process. So we work with an organization called the Small Business Development Centers, and we also work with another organization called SCORE. Both of those, that you can access, like I said, for free counseling to help you through that application process. And I can tell you that the folks with the Pennsylvania Small Business Development Center Network are going to be offering free online courses that we're going to be partnering with them, working through the entire application process to try to make it as painless as possible for you.
Yes, and this is Carol. Unfortunately, at this point, a sole proprietor is not eligible for our particular loan, but I can tell you that we are looking at some changes that need legislative changes, and that's the issue with this particular loan program, that some of the requirements are legislative, and we would have to go to the legislature to make those types of changes. But that has been part of the discussion, yes.
And Shaylee, for your circumstance, I think it only reinforces by one, and you represent so many other people, the need for us to make sure we do robust cash payments to adults and families for those of you, so that you can remain in business, so that you can pay your rent and pay be part of ACA and make sure your insurance is covered. So know that one of my strong focuses is on making sure that we get a robust and, as Mohamed points out, quick, timely payment of cash to people to make sure freelancers or independent contractors can pay their bills. I think our next question, sort of lost track here. Hold on here. Jeffrey, you are up.
This town hall, it's been very informative. So thank you for having the town hall. My question pertained to the cash payments that you were just speaking of. I think there's some confusion as to who would be eligible and who wouldn't, and I just thought maybe you had some more information as it pertained to what your income level is and if you would get a cash payment or not.
If you're confused, you're right to be confused because nothing has been decided. But I will say that there's been really terrific conversations around who is in need. I think because of the gravity of the situation, so many of us in Congress are recognizing that we have to do something that literally 3 weeks ago many would not have thought was even on the horizon, that we have to get robust cash payments to individuals. But in every phone call, in every conference call, the idea is make sure we get it to the people most in need, and make sure that we don't hand out checks to millionaires and billionaires. So every one of these proposals, none of them yet is in law, so that is why you're uncertain of it. But every one of these proposals talks about the need to make sure we get it to the lowest income, the middle income folks, and then phase it out. Most programs, and mine included, my legislation included, would phase it out at the higher income levels, but none of that has been determined yet. Mohamed, do you have a guide or a reference that you would offer us as to the wisest way to make sure we get money to the folks who need it most?
No, I think you have covered it, but I would say, if I may, also to the earlier question on the insurance payments, we are seeing industry groups step up and respond collectively to these issues, and I suspect that we will see insurance companies also pressing the pause button on payments, on having a payment standstill until we all navigate through this. So I think that you will also see the private sector responding to the real importance of not turning a short-term problem into a long one.
That's really true. I've been on calls with small community bankers. I've been in calls with the 8 big banks today. And insurance companies. You're absolutely right. I've been so impressed by the just forward thinking, making sure they're in it to help people. Forbearance on payments, forbearance on any kind of a credit checks, forbearance on mortgage payments. So you're absolutely right. Industries are stepping up and doing unusual things, as they should. We all have to step up. I'll give you one simple anecdote. One of the issues that we're having is supply of masks, and China has re-upped its production of masks. In the airline industry, with their large wide-body planes that are not in use for transcontinental travel, are now going to be flying empty to China to bring back supplies. Lots and lots of industries are stepping up, as we're seeing nonprofits step up, as you're seeing your own neighbors step up. So you're absolutely right. I think there'll be lots of room for folks to make sure that they retain their coverage for the insurance. All right, our next call is from Paul. Paul, would you ask your question?
Hi, Congresswoman. This is Paul from Glenside.
Hello, Paul.
I live in Mount. How are you doing?
I'm doing great. You know Glenside. That's where I was born and raised.
Yep. As you know, I live in Mount Vernon apartments. Across from me is, I believe, Rosedale. It's a Lindy apartment. There's over 200 families that live here. So you know, there's well over 1,000 people. My concern is that maybe, if not necessarily for these apartments, but certainly across the country, thousands and thousands of dollars a month in checks being mailed out, even for a few months, will be seen as an opportunity for rent increases, plus other price increases. I think there's absolutely has to be a cap on rent, because this can't be seen as an opportunity for profiteering, and the only way you can do that is with price controls, and in particular rent control. One other question is in relation to the economics professor, and he can chime in on this. When it comes to giving out this money on a monthly basis for each adult and each child, whatever that sum might be, I don't think we need to get concerned with some sort of means testing and saying that Warren Buffett or whatever, Mark Cuban, shouldn't get a check. Everybody that files an income tax is on Social Security, has a government pension, and anybody that's anywhere on the radar, send them a check. And you know what? Tax the wealthy. Everyone's making over $400,000 a year. Their income tax rate goes up another 5%, personal income tax rate, or capital gains could go back up to 20%. But the more bureaucratic hurdles that get thrown out there, the slower it takes for the money to get out. So I'm basically concerned about rent control and just getting the money out as quickly as possible, claw back the excess from the wealthy through taxes.
I appreciate all those comments. I'll just make a quick comment, Paul. Some of the conversations about making sure that we get some robust direct cash to people has to do with making sure that people can make their rent payments, but also balancing the need of landlords to get rent payments. So I'm aware of your concern about spikes of rent, but I actually think the opposite is going to be what we have to be balancing, that we make sure that people have the money to pay the landlords so the landlords remain in business. We got to protect business and we got to protect the tenants. It has to be a combination of both. Any bad actor out there, excuse me, a landlord who tries to take advantage of the situation, I think would be foolhardy, number one, because this is not a time to increase rents on people who can't pay it. And also, I think government has a role to play to help them with their businesses and make sure you and anybody else in these properties has the capacity to pay rent. Again, this is through no fault of anybody on this planet. This is a global pandemic. It is a virus. We need to get ahead of the health and science and medicine part of it, but we also need to make sure that we play the right role to protect individuals, families in their homes, and the landlords who have the properties. Okay. Wayne, you are up. Wayne, are you available? Did we lose you? All right. Let's try Chris. See if Chris is still on the line. And I really thank everyone for your patience and for being on the line. I certainly thank my hosts for the terrific input that they've offered.
I'm here.
Chris, go right ahead.
Congresswoman Dean, I think you're awesome. I've seen you on C-SPAN. You're doing a great job. My question is for Department of Labor and Industry. I'm worried that I've applied for unemployment. I'll get it. I'm a union member. It's not a big issue for me. I go on and off it as needed. I'm always happy with unemployment, the way I'm treated. He's right. I feel like you guys actually do understand people like me on the other end. I'm concerned that, I'll get unemployment compensation, and then whatever else comes, I'll somehow be less eligible or money will be taken away right when I'll need to get on my feet the most. And someone like me, the second I can get off of any kind of assistance, I will get off it. I will make more money doing my job, doing my work. So, I'm not looking to take advantage of anyone. I'm here to...
Chris, tell me what your work is.
I work in the movie and television industry. There's a couple jobs in Philly right now, and I also work in New York, New Jersey, Connecticut, Delaware. Unemployment has to search through many states to find my money. I have 10, 15 jobs in a year, and yet they work hard, and they've always taken care of me. So I'm much appreciative.
Well, thank you for your important work.
Thank you.
I'm sorry
Chris,
to go ahead.
I'm sorry, Matt.
No, go right ahead,
Chris,
Secretary of Labor.
Thank you for your comments about our staff. I would agree. We are not in the business of punishing people, and there are no plans to play those kind of those systems games. We want people to get back on their feet as quickly as possible. We have federal regulations and rules we have to follow. We have state laws and regulations we have to follow, and we will follow those. But we are not going to look to get money back if in a situation like you're describing. We do it, and normally if someone is overpaid, which does happen on occasion because of the timing and information that people provide, that's a standard part of the system. If there's an overpayment that's kind of built within the system, but in extreme circumstances like that, we're waiving what requirements we can. We'd love to see the federal government, and Matt, this is another thing to put in your legislation. There's a 26-week limit on how long people can collect unemployment, and we'd like to see that extended. So we want to do what we can to make sure people's needs are met, and that we do that as quickly and as effectively and as efficiently as possible.
and I'm really thankful to everybody for staying on the line a little bit longer. And I am very sorry for those whose questions I was not able to get. But I do want to say that please call into our office or go on dean.house.gov and send your questions in. At this time, what I wanted to do is most especially thank all of you for listening. I learned from you, and I need to know what it is you are experiencing in order that I can argue for the best policies to protect you, your families, and your businesses. So I really am very reliant upon you and very thankful to you, and we'll continue this conversation. I also thank the hosts, my co-hosts on this, and I'd ask each to maybe in just 10 or 15 seconds offer a closing thought or comment. Jerry, you want to start us off?
Yeah, I'd like to repeat the websites for one. Follow Dr. Levine, her daily press briefings, health.pa.gov. For unemployment information, uc.pa.gov. And when you go to that uc.pa.gov site, there are links to frequently asked questions, information on COVID-19, other information related to the work of labor and industry. So we will get through this together, as you've heard. Thank you.
Carol?
Yes, thank you, Congresswoman. Just one item I would like to correct that I said as sole proprietorship. I hope the woman is still listening, would be eligible for our program. I was mistaken when I spoke earlier. A sole proprietorship would be. And again, dced.pa.gov/PIDA, PIDA. When you go to that on Wednesday, it will talk about the new program. And I surely hope that the caterer did leave his information so I can help him with his issue. But again, we're here to help as best we can, and you can get to us through dced.pa.gov. Also, it says just the resource account does come to my office, and it will be answered. Thank you very much for this opportunity.
Great, Michael.
Congresswoman, thank you again. Yep, thank you again for inviting me to participate in tonight's call. I want to reiterate to all of the entrepreneurs on the call, SBA is here to assist you. I would encourage anyone whose businesses have been impacted again to call my office if you're looking for some help. 610-382-3062. And the website for disaster loans are going to be disasterloan.sba.gov, and that will take you to the online portal to begin the application process. Thank you very much.
Thank you, Michael. Mohamed?
Thank you, Congresswoman, and thank you all for sharing your experiences. I think the most common word I heard was unprecedented, and not in a good sense. That is what we are going through right now. It takes us out of our comfort zone. It makes us feel scared. And we know what happens to people that are yanked out of their comfort zone, like I am, like my family is, and like many of you are. We either get paralyzed or we overreact. And then we get impatient when we don't see the social distancing result immediately in the flattening of the infection curve. So if I may end up, there's a lot that the government will do, but we also collectively need to do things because, as the Congresswoman said, we're all in this together. We as communities, we as individuals, and we as companies. Companies have to resist the temptation, if they can, of laying off people. That's just going to make things worse. We as households have to resist the temptation of going and emptying every single shelf that we find. And together, we're going to get through this. Again, it's not about a destination. It's about a journey, and we're all on this journey together. Thank you.
Thank you. Thank you to all my co-hosts. And just in terms of some information, please, I was thinking of Richard in particular, the catering owner. Would you please call and give us your contact information, or anybody that has anything they want to offer me? My office number is 215-884-4300. Again, 215-884-4300. In addition to watching each day for the state's updates, I want to give a commendation to the commissioners here in Montgomery County, Dr. Valerie Arkush, and Ken Lawrence. Each day they are offering updates. We have been the beginning and the epicenter of this crisis here, and we are well served with a physician as the chair of our county commissioners, Dr. Valar Kush, ably helped by co-chair, Ken Lawrence. So I want to commend all of you to the website there and look for their daily briefings as well. In the end, I want to go back to where we began, which is to thank all of you and to say we are in this all together. A reminder to you, and I say this to my staff each day, this is going to be a long haul, a journey that we've never been on before. Be sure to take care of yourself. Be sure to take the time to go get a walk, do something that you love, whatever your hobby may be. My chief of staff happens to cook well, so when he's stressed beyond words, he goes and cooks something. Each of you take the time to make sure you take care of yourself because this could be a very long haul. And also take the time to look at the upsides, the time to be closer to family, even though sometimes it may get a little maddening. I'm going to end with a quote that I love by John Fitzgerald Kennedy. He said that no problem of human destiny is beyond human beings. I'm a real believer in that. This is not beyond us. This is something we can tackle. We will come out, hopefully, with vaccines and treatments that will improve the health of folks for a long time to come. And also, hopefully, we will mitigate and minimize the financial distress on all of you and all of us. So with that, I want to just say a sincere thank you and thanks to all of you. Have a good night.